Methicillin-resistant Staphylococcus aureus, MRSA, was first discovered in 1961 in the United Kingdom, just 2 years after the antibiotic methicillin was introduced to treat Staphylococcus aureus infections. The emergence of MRSA represented a significant challenge in the treatment of bacterial infections, as it showed resistance to many common antibiotics. Methicillin-resistant Staphylococcus aureus, MRSA, infection is primarily transmitted through direct or indirect contact. The most common way it spreads is through skin-to-skin contact with an infected person or a carrier of the bacteria. MRSA can also be contracted by touching objects or surfaces contaminated with the bacteria, such as towels, sheets, wound dressings, clothing, workout equipment, or surfaces in healthcare settings. Wounds provide another significant route of MRSA infection. The bacteria can enter the body through cuts, abrasions, or any breaks in the skin, which is a particular concern in healthcare environments where surgeries or other invasive procedures are common. In certain circumstances, MRSA can be transmitted through respiratory droplets, although this is less common compared to other methods of transmission. This typically occurs in healthcare settings when an infected individual coughs or sneezes. MRSA infections are not limited to healthcare environments. They can also occur in the community, known as community-associated MRSA, or CA-MRSA. These infections are typically spread among healthy individuals in community settings through physical contact or shared items. Understanding these various routes of transmission is essential for implementing effective measures to prevent and control MRSA infections, particularly in communal spaces like gyms, dormitories, and military facilities, as well as in hospitals and nursing homes. Methicillin-resistant Staphylococcus aureus, MRSA, infection manifests in various forms, with symptoms largely depending on the affected body part. Commonly, MRSA begins as skin and soft tissue infections, often appearing as swollen, painful red bumps that may look like pimples or spider bites. These areas can be warm to the touch, filled with pus or other drainage, and are sometimes accompanied by fever. When MRSA infects the respiratory tract, such as in cases of pneumonia, symptoms can include coughing, difficulty breathing, chest pain, and fever. In more severe cases where the infection becomes systemic, spreading throughout the body, known as sepsis, symptoms are more extensive and can include high fever, chills, low blood pressure, joint pains, severe headaches, shortness of breath, and possibly a widespread rash. In the context of wound infections, MRSA leads to redness, warmth, swelling, and pain at the wound site, often with discharge of pus or other fluids. Additionally, urinary tract infections caused by MRSA are characterized by symptoms like pain or burning during urination, an urgent need to urinate, and cloudy urine. The severity of MRSA infections can range from mild skin conditions to life-threatening scenarios, especially in cases where the infection reaches vital organs or the bloodstream. This variability is particularly concerning in individuals with compromised immune systems or those in healthcare settings. Given the potential severity of MRSA infections, early medical intervention is critical for effective treatment and management. Treating methicillin-resistant Staphylococcus aureus, MRSA, infections involves a comprehensive approach tailored to the severity and location of the infection. Medical treatment primarily includes the administration of specialized antibiotics, such as vancomycin, daptomycin, linezolid, or ceftaroline, chosen specifically for their effectiveness against MRSA. In cases of skin infections, a key part of the treatment is the professional drainage of abscesses or boils. This procedure is crucial and should be performed by healthcare professionals to prevent further spread of the infection. For more serious MRSA infections, supportive care in a hospital setting may be necessary, which can encompass intravenous antibiotics, fluid administration to prevent dehydration, and treatments supporting organ function. Alongside direct medical treatment, infection control measures are vital, especially in healthcare environments. This includes rigorous hand hygiene, the use of personal protective equipment, and, when necessary, the isolation of infected patients to prevent MRSA from spreading. Topical treatments, such as antibiotic ointments or creams, might be used for minor skin infections. The treatment plan often requires regular monitoring and adjustments, especially if the infection does not respond to initial antibiotic choices. For patients with underlying health conditions, effectively managing these conditions is an integral part of the MRSA treatment strategy, as it can influence the overall success of the treatment. When treating MRSA infections at home, it's important to maintain good hygiene, keep wounds clean and covered, and adhere to the full course of prescribed antibiotics. This home care is essential in controlling the spread of the infection and ensuring effective treatment. It's imperative that MRSA treatment is overseen by a healthcare professional. Self-treatment or delaying medical intervention can lead to serious complications. The specific treatment plan will depend on individual factors, including the patient's overall health and any underlying conditions, highlighting the need for personalized medical care in addressing MRSA infections.